And I think the second reason was because I think we have like a mixed feelings when we are living with these situations and complications. We can have in one hand, like we are on the top of the pyramid because we are receiving patients from other colleagues and you are the last chance to save that tooth. And in the other hand, we broke instrument during our root canal therapy and we have to change your mind, we have to change your treatment plan as well. And at the end, you have to do another thing that you did not plan at the beginning of your treatment. But let me introduce my city. I'm from Portugal. I'm from Porto, this beautiful city. So I'd like to invite you, all of you, to visit my city and country after this pandemic season. And we can see that we have beautiful places to chill, to relax, to eat good food, and to pass a good time with our people. And who I am, and this is my new me. My name is João Meirinhos, and I did my master degree in 2014 in Instituto Superior de Ciências de Saúde do Norte. After that, I did an endodontic course by Rui Pereira da Costa, and I think it was there that I just realized that my passion for endo has just started. And 2 years later, in 2016, I decided to make my registration on a post-graduation in Lisbon that I finished last year. It was 3 years full-time in Lisbon, a very good experience. And during my path in endo, I received also an invitation to be part of this team led by Rui Pereira da Costa. And in 2018, I also received an invitation to be part of Style Italiano Endodontics. And let's talk about endo. So when we have to prepare something to present in this type of congress and webinars, we have to, it's not only important to share our beautiful cases, the initial and the final x-ray, we have to justify your steps, justify your each step that you are doing, each file that you are placing, the obturation technique that you choose, and we have to follow evidence-based medicine. And this is not what we find on Facebook. Even it's impossible to find this evidence-based medicine on Instagram, or we cannot achieve that information by a phone call, or even it's not our experience. It's something that we can find on PubMed, for example, or Cochrane, in very good databases, journals, guidelines for American Association Endodontics, for example. And when I was looking something to present to you today, I found more than 500 articles only about this topic, only about separated instruments in endodontics, which means that is a lot of information that we have to select and to place in your presentation. So in my advice, we have to look less for the face and more for the book. And regarding this subject, the books about endo, I found one book that represents everything that I'm talking here today with you. It's from Lambriadinis. It's a recently book from 2017. And if you stay with me till the end of my presentation, I have a surprise for you, because I will give you free access not only to all the articles that I will present today, but I decided to include this book on that folder. So regarding and between the success and the failure, we have different steps that we have to follow. For example, the diagnosis is one of the most important steps, because it's where we can define our treatment plan. And the cleaning and shaping, because we shape to disinfect, and is something that Stephen Buchanan already talked last Friday very well. And we know, and we will know at the end of my presentation, that the fact to have a separate instrument inside of the root canal does not will not any influence on the prognosis of the treatment if you disinfect well all the root canal system. And obviously the 3D obturations, it's important not only to seal the apical part, but also the coronal part of our treatment to prevent any leakage by the pulp cavity. And let's talk about the top secret topic, that is endodontic files. We are not proud to break files in the past, and we know as a definition that this situation, this complication, is a frustrating complication, and we know exactly what can cause this situation. It's most of the time it's the overuse or the improper use of the instruments, and we know how can we prevent these situations. And for example, for the young guys or the guys that don't like too much to to do endo and to do root canal treatments in their clinical practice, the feeling on the night before the root canal treatment is like this one. They are afraid to breaking file. They are dreaming about each step that they have to do on the day after. And however, on the next day, with the patient on the chair, we will have a nightmare in the dental office, because we know that something is not going to happen the way we want, and we have to change our plans, and everything that you dream is not going to happen on the chair. So we can see, and taking this tooth as an example, we can see a simple case, irreversible pulpitis, a lower molar. I did on my first appointment, my periender restoration. I was able to reach the apex, to took my working length. We can see 4 apical exits, and I did not have time to finish this treatment in one session. So I did my second session, my second appointment. And on this appointment, I think all of us, we can have bad days in our endo life. So this was for me a bad day, because in minutes I broke one file on the distal root, and a minute after I broke another file on the mesial root. So here my mind changed automatically my treatment plan. I had to think clearly about the next step. And this is what we have to do. We have, for example, we have to count to 10, we have to take a deep breath, and then we have to think clearly about the next step. And I will talk about the different decision making that you can have on this specific situation. But with 4 apical exits, our goal, and we know that I did not disinfect everything, because the breakage here was done on at the beginning of my treatment. So I was not able to disinfect everything completely. So I had to do something. And in this case, what I did was I tried to do the bypass. Is the first thing that we have to think, inclusively with the files on the apical part. We have to know that the bypass is your first option. After that, I did my master cone X-ray, and everything disinfect, clean, and obturate. I know that this was not what I